So my name is Jessica. I'm a student at UW School of Medicine and Public Health, and I'll let you introduce yourself.
Hello, I'm Jessica Brownrigg, currently working in private practice as a therapist and an individual in long-term recovery.
Great. So thank you for doing this interview with us today.
Thank you.
I guess my first question is, how did you get connected with the organization, the Wisconsin Voices for Recovery?
Great. Well, still technically am a recovery coach for WORCO, the Wisconsin Recovery Community Organization. And so that organization is partially funded through Wisconsin Voices for Recovery through their ED2 program. So that is how I was originally introduced to Wisconsin Voices. And then my fiance now works there, Aaron Claiborne. He's, I think, an outreach specialist there. So that's what connected us to this interview. Yeah.
Okay, great. And I guess just to give some background, would you like to give sort of a broad summary of, what your journey has been and what that's looked like for you?
Right. Yeah. So like most people in recovery, my family has addiction and its family in different family members. Right. So that's kind of what I grew up in. And I won't like get into all the details of that. That would take way too long. But basically, I heard of AA early on in my teen years, and then realized, I had a drinking problem in my 20s, and I quit for a little while then. And then I started back up again and was pretty much in and out of the rooms until March of 2016. So yeah, and then I kind of started listening to what people were telling me, primarily my sponsor, and I was able to get recovery and maintain long-term recovery since then. So
that actually leads nicely into one of the other things I wanted to talk with you about. I understand that it's pretty common to have, like you said, to be in and out of the room, to have, try to get started on a recovery journey multiple times before you really get to a long-term point.
Right.
What do you feel like in retrospect was different, or what was in place for you that helped you be long-term successful that maybe wasn't there, during your earlier attempts?
Right. Another great question. So I was, reviewing everything this morning, and I was thinking, first of all, like I said, I found a really fantastic sponsor, and she was very patient with me and always available and taught me a lot about the steps and the program, but more so about myself. And I basically just had to, I feel like I couldn't maintain long-term recovery because I wasn't like digging deep and getting honest with who I was. So I needed to do that first. So for me, it's been and it still is just a journey of self-awareness and how to overcome, resentments, and how to accept, learn when to accept and when to change. So, yeah.
Thank you for sharing that. Now, you mentioned at the beginning of the interview that you are currently working at or practicing as a therapist.
Yes.
And I understand that, there were also mental health struggles that played, that were intertwined with your recovery journey. Can you talk a little bit about that?
Right. So like I said, I was in and out, and then in early 2000s, I became addicted to painkillers due to some pain that I was experiencing, obviously, right? And back then in the medical community, it was painkillers were pretty readily available. They were, until now, where we're starting to shift that. But anyway, so I ended up getting sober, and this is what happens sometimes that I don't think people talk about enough. But when I got sober, I actually experienced my first psychotic episode. And I ended up being institutionalized. And when I was institutionalized, the institution that I was at, in my mind, before I was there, had like this idea of what an institution would look like for people that had mental health issues, and this was not at all that. It was, in my opinion, it was a scary time for me. It was very not a healing environment at all. So I know, a long story, but so the painkillers, I think, had been masking some of my mental health symptoms. And then when I got sober, they kind of just came out, right? So what it took me some time to work with my, like, basically, healthcare team, my psychiatrist and a therapist, to get on the right medication. And that's what I think happens often is, we self-medicate. And then when we stop, then that's when the real kind of health challenges present sometimes. But so while I was in the institution for 9 days, like my 9 longest days of my life, I just thought, like, that we've got to do better than this. It just, like I said, it was not a place for healing, in my opinion. So I, at that point, was like, I'd always had the dream to become a therapist, but I always thought, I can't do that until I have myself in order, all of, and am more self-aware. So then I started to gain some more long-term recovery, and finally I said, I think I'm strong enough, and I think I know myself well enough, and I'm healthy enough to be able to start the journey to be a therapist, to be part of the solution. Because I do think getting obviously appropriate treatment, including therapy, can be huge in someone's recovery.
So now that you are sort of on the other side of that fence, working as like a mental health care provider, how do you feel like your experiences, your past experiences as a patient are helping, do those inform how you practice and how you work with your patients now?
Right. So the approach that I use as a therapist is what's called person-centered therapy. So I try to provide an environment that's non-judging and unconditional positive regard and empathy. So so before I became a therapist, I became a recovery coach for Worko, and then I moved into being a peer specialist for MHA, Mental Health America of Sheboygan. And that's when I started really learning the craft of empathy. And so that's what I try to do with my clients. Of course, there's more boundaries and self-disclosure limitations as a therapist, which I respect. But I think my experiences allow me to basically, like, feel what the other person has felt, and if they've been chaptered, as they say, or on commitment, or institutionalized, or had mental health issues after getting sober or during their use, I feel like I have a much deeper level of empathy for that person. So that's what I try to convey in my practice. Does that make sense?
Yeah, it does. Thank you. So it sounds like you were on your recovery journey. You were getting sober when the mental health issues sort of came to the forefront. Do you feel like at that time you had resources, or you had people around you to help you recognize what was going on?
That is such a good question. I would have to say no. My family, because I had like 3 days of an episode, and my family was just bewildered. They were just kind of like, what do we do? We're familiar with addiction, but not so much the mental health, right? So, and I don't think I was connected with a therapist. I was with a psychiatrist at that time. So, yeah, I think, and I didn't have a sponsor, and I didn't have a recovery coach that I used. So I definitely think that the resources weren't readily available for me in that time. I think since then, for sure since then, because that was like 2012. I definitely think we've made improvements in focusing, or at least like offering more mental health options to students in schools and just to the general public. I think it's becoming much more normalized to a certain extent. So yeah, I don't know. Again, did I answer the question?
Yes, yeah. I guess, yeah, what I was trying to get at is, like in, I guess the framework of the recovery community, like is there like an awareness that, like a lot of folks will have, these struggles with underlying mental health issues and,
Right.
is
Okay.
that sort of part of the,
Yeah, and I would have to say, as far as like the the AA community and maybe even the NA, I've only been to a few NA meetings, but um I would definitely say that there's not enough information on mental health resources. Again, I feel like we're starting to, shift the pendulum, and it's becoming easier, but or more accessible, and more people are more aware. But I think there's still some reluctancy, because I go to speakers, to see them share their experience, strength, and hope often. And I think there's still some reluctancy on sharing mental health. Again, I think it's getting better. Um, and I hope that it continues in that direction. But so far, I feel that there's not a whole lot of um, emphasis on mental health as well as addiction when in the local community.
oh, wow, thank you for sharing that. That sounds like I don't know, an opening for,
I know, right?
yeah, where there could be more work and more resources.
Right.
Um, so we kind of talked about what brought you to becoming a therapist, and some of the care that you received, as a patient. So when you were a patient, either, in that inpatient setting or even just, like at regular doctor's visits or any other like interaction with the healthcare system, how do you feel like, um, your history with substance use affected your treatment? Do you ever feel like you were treated differently or, um, received
Right.
less than treatment
Hmm.
because of that history?
Right. Actually, it's interesting because I recently had to be seen for, I'll just say specifically for pancreatitis from an allergic reaction that I had apparently to a medication. And I presented to the ER, and they immediately asked if I had an issue with alcohol, and I said, not now, not, like 5 years ago. um, and then I actually put on my chart that I'm allergic to painkillers. I'm not, but I put that on so that I put that out there for myself as kind of a safety measure. And so and they use painkillers to treat pancreatitis because it's very painful. And the staff was actually really non-stigmatizing at all. And really wanted to respect my trying to use whatever I could beyond painkillers. So we came up with a really great plan. So my personal experience in healthcare has been overall actually pretty good considering my substance use history. But I will say, in hindsight, thinking of healthcare overall and clinicians and some of the experiences that I've had, not as a patient, but as a recovery coach. Um, if you don't mind me commenting on that,
No, of course.
um, I have presented to some of the emergency departments where the doctor or a nurse will say, oh, here's our frequent flyer, patient here again, withdrawing from alcohol or withdrawing from, whatever, and very obviously condescending, I guess I would say. Um, so as a recovery coach, I would always try to like provide empathy to the clinician, right? But also like provide some like education, because we all know like the relapse rate is pretty high for people. And it's unfortunate that the medical community just kind of labels, and not all of them, right? I'm just saying a couple of circumstances where this happened for me, would label them as like a frequent flyer, because in my opinion, that's a good indication of, okay, well, what can we be improving on, right? And again, I think at least in our community, the emergency departments and the clinicians are getting better at what can be done differently. Like I know Worko just rolled out a new program to offer Suboxone to people that are presenting like right on the spot. So stuff like that, I think, is going to start again, like hopefully shifting that stigma, kind of producing clinical opinion and start shifting it to what can we be improving on? What can we do better to avoid the relapse rate, right?
Yeah.
Yeah.
Yeah, thank you for that input. That's definitely something that, yeah, like early in my career, like as a learner, um, that I've definitely been exposed to and heard, that kind of language,
Right.
around people coming in, like in
Hmm.
withdrawal and things like that. And
Right. Right.
so
Here
it's
we
good
go
to,
again,
yeah, try to
Yeah.
think of like a different way to frame that and a different way to approach that
Hmm.
mentally.
Right. And I've met a few doctors too, so I should point that out. I've met a few doctors too who are really great at like thinking outside of the box for solutions. Like I've heard that you can use, I think it's, well, I don't know if I should get into it, but I've heard you can use some medications to help um, with withdrawing from crystal meth. Obviously we know about Suboxone for opioids, but I think some of the clinicians are getting better at being more educated on addiction to try to come up with more solutions for the community, which is awesome to see.
Yeah. I'm glad to hear that from your perspective, there's been some positive change in that
Hmm.
direction.
For sure. Yeah, I definitely think there has been. So.
So kind of staying in the vein of like stigma or differences in treatment around people in recovery. So it sounds like overall, in healthcare, that's been relatively positive for you. But do you feel like there are any areas where that stigma has been really apparent? Um, and that you would like to see like, wow, that's a place that could really be changed?
As far as healthcare systems, is that what you mean?
No, not even to anything.
I mean, like, I don't know if this applies, but I think we're aware of I think it's Medicare and Medicaid or Forward Health. I sometimes don't know the delineation of those, but the state insurance, quote unquote, we know that they came a long way with offering to cover insurance for residential treatment starting, I believe it was in February. So that was a huge win, right? It was like, great, this is awesome. People can finally, use their insurance to get into residential treatment, which is, in my opinion, one of the best things to do in chronic and early recovery, chronic addiction and early recovery, right? Just to be in a safe place for a while. However, I've since learned that it covers the treatment that you get in residential, but it doesn't cover the room and board.
Oh,
So, yeah, it was kind of like a win, but still, I mean, people in recovery usually don't have access to the kinds of funds that would be required to, pay for room and board. So again, though, a lot of times I think we try to, in the systems, try to come up with creative solutions. So I know there's places like, the Sheboygan County Health and Human Services, and probably, throughout the state where you can go if you're really in need of treatment and try to get funded through, a caseworker or something to that effect. So again, progress, right? And which is very positive, but at the same time, and then you don't even get me started on the wait list, and the not being able to get in, when you need it, because we all know when someone's ready, it's like you just want to get them placed as soon as possible. And unfortunately, that because of insurance restrictions and what's that called when you have to get it covered, prior to actually admission,
pre-approval or something.
right? Yeah, something that can be frustrating too. So yeah, like I said, I think we're making progress, but I definitely think we're not quite at the same where we treat, a medical condition and addiction the same. Not quite yet, but we're getting there.
Yeah. So what do you, I guess, in looking back on your own journey so far, are there things that you can pick out in your mind that were particularly helpful coming from like friends or family or clinicians, that really, were supportive, particularly supportive to your journey?
Mhm. That's another good question. Um, I think for me, I really needed to get the help that I need. I really needed to be consistent with the help that was available to me. I needed to continue to see my therapist once a week and my psychiatrist once a week, and um, to get that added support, and then work with my sponsor. The two things that I've learned in this journey of recovery, I learned on my own, and I tell everybody that I talk to, that I meet with as a therapist, anyone who struggles with substance use, I always say, two hardest things I've ever had to do, and I have to do it every day: take care of myself and balance. Those are the two things. And I think sometimes that message isn't clear when you're in early recovery, because I think oftentimes, not all the time, but oftentimes people with substance use, or some, addiction, they tend to be really great at taking care of other people. And then the idea of taking care of themselves is just something kind of foreign. So it's just, like I said, it's definitely the hardest thing I've ever had to do. And I have to try to practice it every day, and be able to recognize when I'm not doing those things, and get back on track. So I guess another long winded roundabout way of answering, but those are the two things that I try to emphasize when I work with people in early recovery. So
No, that's great. And I guess that sounds like I was actually going to ask you, like, what's something you wish you had known earlier, that you could tell somebody, earlier in recovery. And that sounds like those things. Do
Right.
you
Yep.
have, like, are there practical tips that you give people that you're talking to about, like, how do you accomplish the balance and the taking care of yourself when you're sort of like in the trenches?
Right. So I kind of wanted to touch a little bit more on the mental health aspects as well in this, if that's okay. Because I think oftentimes people self-medicate depression and anxiety, right? Too, because it's especially anxiety, it can be really isolating. And so when someone discovers that they can have a few beers, or they can, take a pill and not have that social anxiety or that anxiety level, it can be really addicting, right? And then when that resource is gone and you become sober, you still sometimes you have to learn new ways to handle the anxiety and the depression. And I've seen many people come in the doors with both of those challenges, and I've seen it fall off after six months to a year, sometimes a little bit longer, because we know that you're self-medicating, but you're also getting another set of symptoms when you're using substances, right? So I think, like, that's the practical tools that I try to provide are basically, like, what are you doing every day to take care of yourself? Like, and then and so when you talk about anxiety and depression and addiction, the same kind of mentality, right? Like, are you getting enough sleep? Are you trying to get outside, get some exercise? Are you taking some time for yourself, just some calm, relaxation time? Are you, eating appropriately? And just kind of like I said, just doing a checklist every day to make sure that you're in balance, and that you're recognizing when you're not. Those are the things that I try to teach people every day. And I also caution on two things in early recovery: boredom, and that can be a real tough one. And so trying to get out there, that's why the fellowships are out there and the recovery community is out there, right? And the other thing is, like, shopping addiction. I think people can switch pretty easily to, especially if they have access to Amazon, to all of a sudden, they're getting packages almost every day. And we actually had to do some work with some of our peers when they got the stimulus checks, like, what do you want to do with this? Let's make a plan for it, because it can be hard to have cash. I think I just digressed onto something. But the other thing is that I caution against on, that I think can be really helpful, is that happiness itself can be a little scary for people in recovery. So again, like, I try to just normalize it with people and say, like, at one point you're going to realize that you don't have a lot of drama anymore. You don't have a lot of chaos, and it's going to feel uncomfortable. So, when you do get there, give me a call, or give someone a call that you can talk to, or get out and get connected. So it's all about connection.
Do you feel like you had a moment like that where you had a moment of realizing like, oh, like I'm calm, I'm good, I'm happy, there's nothing around me. What do I do with this?
Yes, yes, very, very much so. Yes. I know it happened probably like a year into my recovery, because I didn't have, like I said, all the drama and chaos anymore, and life was pretty kind of boring, right? Just and that's the good stuff. That's the great stuff that, we talk about, like the gifts that we're given in recovery. And to me, it's always the little things, it's like I get to wake up with my son and give him his lunch, make sure his lunch is ready every day. That used to be like the hardest thing for me to do for some reason. I get to like go to, graduation ceremony for my older son and bring him to college. And, he's proud of me because he sees that. And like in the past, like that would just never have happened. I wouldn't have even been like, aware of my surroundings. So that's the good stuff that you get in recovery. And like I said, it's not always the big stuff, it's the little stuff. It's the sunsets with your kids when you take 5 seconds to just enjoy it together. Walks and practices, whatever. Just being able to be present with my children is the biggest gift ever. So again, I digressed on that one.
No, that's quite all right. Digressions are welcome. Since I didn't know that you had the two sons, would you mind talking a little bit about, like how your relationship with them, has grown or changed throughout your journey?
Yeah, no, I don't mind at all, because that is probably my the thing I'm the most proud of. And I'm sure I'll get emotional, but I'm all about, feel the feels is one of my favorite things. And again, something I learned very early in recovery, has it used to be, that's what we do. We don't want to feel. We use a substance to not feel. So now I just welcome the feeling and go with it. But luckily my eldest is 19 now. And then my youngest is 10, and neither one of them really remember mom being anything but sober. So that is a gift. I think my eldest had like a couple memories that he can recall. But one of my proudest mom moments, I have to admit, was so I guess backtracking, like my relationship has changed in that I see them as a gift. And in the past, and this sounds horrible, but it's true. And I sometimes talk a little bit about mom guilt and and why I think there aren't enough women in AA. I think that's a huge barrier. No research on that. But anyway, I think just being able to be present, like I said, with them is really what the gift is. And they, like I said, don't know me beyond being in recovery. So like tucking them in and just being more present with everything that we do is just part of how our relationship has changed. Because in the past, like, I guess that's what I was trying to say. In the past, they were kind of someone that got in the way of my addiction. Now they're where they should be. They are important to me. They're valued to me. We have family dinners every day, and we have, movie nights and whatever. And so one of my proud mom moments was my son, for his senior project, he did a presentation on opioid addiction in America, and he was very passionate about it and asked me for some information. And on the presentation that he did, he had a couple of quotes, and he had some work-o information because I was the executive director at the time there. So it's stuff like that really make you kind of realize that even if you don't think your kids notice, they do.
How do you talk with your kids, maybe especially, your older son,
Mhm.
about, your own history and like the larger family history
Right.
around substance abuse?
Sure. Yeah, that's a great question too. We have always, my eldest, well, both my kids, but for sure my eldest, we've always been very open, and I always say, I will listen to you without judgment anytime you need me to, and then I just continue to provide education, and we talk about, he's seen some of my family members in active addiction, and I think it's kind of seen enough to know that he doesn't want to go down that path. And so I just check in with him regularly. He's in college now, so I'm always just saying, like, I know that you're going to experience what you want to experience, but you see some of my family members, the risk that you have for, addiction as well as mental health issues based off my upbringing or my genetics. So, just be mindful of that. My biggest thing is I'm always asking him if he's been offered any pills, because it's such a scary time right now with fentanyl out there and pretty much everything. So luckily so far so good, he has not been, but he knows that that's a real risk, and so we talk pretty regularly about that.
And you mentioned something sort of offhand earlier, about the issue of like mom guilt being a barrier in recovery and in AA. Could you talk a little bit more about that?
Right. Yeah. Again, this is just one of my theories, and I don't know how it is nationwide, I would say. I went to treatment in Florida, and there were actually quite a few women there, probably equal to men. Whereas here in Sheboygan, most meetings are primarily men. And I was always curious to, like, where are all the women? So I think, societal standards of a woman, typical, again, my opinion, typical societal standards are that we are the caregivers. We put ourselves second and our children first. Well, when you're in addiction, that's usually not how it goes, unfortunately. Hangovers can prevent you from taking care of your kids, and you could be, like, for instance, someone in their active addiction could be driving with their kids in the car, right? And so I think sometimes I think that guilt of not being the mom that is expected of you can prevent you from getting treatment, if that makes sense.
Yeah.
And that's why I share that, because, like, my darkest moments with my children were pretty dark, so I'll share that part of my journey to hopefully provide space for other people to know that you're not alone. When we're in our active addiction, we're not our true selves, and it is not a reflection of who you are as a mother, if that makes sense.
You think there's like a fear of, more judgment or like recrimination in seeking help with recovery?
I do. Yeah. I do. And like I said, just because of the society that we live in, again, I think it's starting to shift a little bit more, and there's more equanimity between parents. I think that more women are asking, are in the workplace and all that kind of stuff too. So, but I just think sometimes that fear of, like, being judged and admitting, like, a kid found my needle, or, like, is really, really tough to get past, and keeps you in addiction, stuff like that.
How do you feel like you got past that barrier in your own journey?
Yeah. Wow, that's a good one.
Or maybe I'm thinking about it wrong. Maybe it's not like one barrier that you just get over.
Yeah. Yeah, you know what? I think you're right in that. I think, and that's the other thing we talk about too every once in a while with people, is that you also have to realize your self-love. You need to love yourself enough to be in recovery, to know that you're worthy of recovery. I think that can be, the propensity to self-sabotage is real, and that can happen. especially in early recovery, and that's what happened to me. I was on what I call the 90-day program for, I think, like a year, where every 90 days I was like, I got this, and then I can just have one, and then I got to start all over again. And I broke that by, like I said, getting a really great sponsor and just starting to do the work and do the self-examination and call myself out and reach out and stay connected. So I think that would be the way that I remove the barriers. And I think another thing is, depending on the speakers that you listen to, I think there's, some of the speakers in the community, some of the members in the fellowship speak pretty raw and real about their experiences. And that gives more courage to others for them to share and come and not feel like they're going to be judged.
So it sounds like finding like a sponsor, a mentor that like that you really clicked with, that was, right for you, was pretty key. Would you have any, I guess, insights or thoughts to share about that for somebody who's in that space of trying to make that connection?
Yeah, I think, what I'm not sure if you've heard it, I've heard it before, but what I try to talk to people about in early recovery too is like, your alcohol's out there doing push-ups, right? So you need to bring your game, your full game, right? You need your toolbox as full as you possibly can. So that to me means like, getting a recovery coach and a sponsor and a list of friends that you can call that you can rely on, and just building that toolbox to have. So that's what I would say. And then just do the work that you don't want to do. One of my counseling friends had one of my favorite sayings is, sometimes you got to do the things you don't want to do to get what you want. And that's true, especially in recovery.
And I think if there's anything we didn't cover that I wanted to cover with you. I think we've answered all my questions. So I guess I'll just ask if there's anything that you feel like is important that you really want to, to put out there to this community who might see this video.
Right. Well, I think you asked this before in a roundabout way, and I kind of answered it. But I think one of them questions was like, how do you recommend people like destigmatize in recovery? Like whether that be a family member, clinician, or a peer. What are things people can do to start removing the stigma around recovery, which is a great question. And my answer to that was to be curious and caring, right? I think, and try to see addiction for what it is, which is a mental health disorder, right? Just like any other mental health disorder. And it should be seen and treated similarly. So I think just to be curious about it and learn as much as you can about it is one of the best ways to go about destigmatizing. And I have a kind of a cool example of this. Recently, because you had also asked if I had ever seen stigma surrounding addiction in my community. And recently there was, I won't say the community, but a local city that was, they were proposing a sober living in a neighborhood. Some people, investors, I guess, wanted to purchase a building and turn it into sober living. And I saw through some friends that some of the people in the neighborhood were passing out flyers that said, do you really want, men in this building who are in recovery when there's a school across the street and a dance studio? Do you really want your children to be seen? And they were really spinning it hard on and it was very stigma producing, if that makes sense. And one of my friends, actually kind of acquaintance friend, lives in that area, and she messaged me and she said, hey, this is happening and I don't know much about recovery. Could you tell me, like, what could I expect from a sober living place? Like, what are things what do you think of this? I don't know what to think, and there's just so much controversy happening right now. Can you help me and educate me on what that looks like? And I was so pleased that she did that. And that's what I'm talking about, right? Like, don't just feed the fear, but find out, right? Get educated, find out what that. And and ultimately, because the place they're trying to buy used to be a bar. And it's like, ultimately, it's really no different. I mean, people, and the one thing I will say is when you're in recovery and you're in treatment, you really don't have much awareness of the outside world anyway. You're just fighting to stay alive and to kick your addiction. So that was kind of how I handled that. But that was the only other things that I kind of just wanted to comment on. I hope that's okay.
No, of course. Thank you for sharing all of that. Yeah, it's wonderful to get your perspective on
Yeah, and I just
what
hope
can be
that,
helpful.
the work that you guys do with having, people share their experience, strength, and hope. Um, and I think that is becoming more prevalent too, to a lot of organizations, just having people come and share whatever their journey looked like, and to be upfront and honest, because I think it, like I said before, it normalizes it so that more people are apt to seek the treatment that they need. Um, and yeah, so it's just been a beautiful journey for me. And in the end, it really is just about, in my opinion, knowing yourself and knowing when you need some extra support, and then reaching out. Because I think that one of the definitions I saw about addiction is so true. Addiction is disconnection, right? It's like isolation, and the opposite of that is connection. And so I think that's what I try to do as a therapist. That's what I try to do as a mom. And that's what I try to do as a peer. And then that's what I do for my own recovery, is just stay connected.
Thank you, Jessica. It was so
Yes.
nice to meet you
Yes.
and have this chat with you.